The mission of Neighborhood is what really makes it stand apart from everybody else. We are focused on working with our community health centers and really working with high-risk individuals or people who are at risk in our communities. 20 some odd years ago, it was focused on providing health care for moms and babies. But now we've grown into where we actually have single adults. We have folks who are elderly, folks who are disabled. The Affordable Care Act had a major impact, not just across the country, but particularly in Rhode Island. I think we were actually well prepared for such an initiative by the federal government. Many of the folks in Rhode Island that are now covered under the Affordable Care Act were being seen by our health centers and provided care through Medicaid or other services. Right now, we have about half the folks that get their health care through the exchange come to Neighborhood for their services. Just over 2 years ago, we were serving 90,000 Rhode Islanders. We're now at 190,000 Rhode Islanders. We think that's a positive note for not only Neighborhood, but these are folks that didn't have access to care before, so this is an opportunity to get affordable care in the hands of people who need it most. It boils down first about choice. It's making sure folks have the ability to make their own personal choices about themselves, their families, or their relatives. The other is making sure that we ensure there's a good quality network and being transparent about the range of services that are out there. Community health centers, they're considered best in class in the country. We have great hospitals, and we certainly have great private providers out there.
Taking care of our members and taking care of vulnerable patients requires a real commitment to community as well as a real energy, if you will. By really emphasizing open communication and commitment, we're able then to create innovative programs that target resources and efforts at certain populations. One example of that is our house call program for super utilizer patients. People who go to the emergency room many times in a year and are often admitted to the hospital. These patients tend to have severe chronic illnesses in combination, so diabetes, heart disease, lung disease, and depression. We at Neighborhood visit the home and work with the patients to make sure that not only is their health care improving, but that they have alternatives to going to the emergency room.